Well, not even a year after changing the governance structure of our health system, the government is switching it again, announcing the end of the reign of Health Commissioner Lester Levy and reinstating a board. Minister in charge, Simeon is also promising to clear the backlog of more than 10,000 elective medical procedures by the end of June. Here's Imogen Wells.
Could just let Sam summarise it.
Our new look health minister's itching for change.
I'm very much focused on putting the patient back at the centre of every decision.
Announcing today he's scrapping the Lester Levy-led commissioner structure put in place in June 2024.
Minister, have you effectively sacked
No.
Levy today?
I have full confidence in Professor Lester Levy.
Levy's contract for heading the health sector was only for a year. Now it's back to basics and a board.
Is this an admission then that the framework your government put in a year ago was the wrong thing to do?
No, it was the absolutely right decision at the time.
This government has unleashed chaos on the health system. I'm pleased today they are taking the step to turn it around.
Levy's time at the
Rather positive from Aisha there. Carry on.
helm hasn't been smooth sailing, with a handful of high-profile health resignations and controversial attempts to balance the agency's $30 billion budget.
Lester Levy has been incredibly destructive and secretive as a commissioner.
Look, he has been doing a great job.
Some in the sector not overly pleased with the governance flip-flop.
From our perspective, we will work with whichever government's in power. We will also work with whoever's in the health leadership roles, but it's very challenging when you have a revolving door.
The commission was never intended to be in place for a long period of time. It was there to make sure we stabilised Health New Zealand.
The minister's so confident it's stable enough, he's also announced a $50 million package to clear a backlog of 10,500 elective procedures between now and the end of June via a partnership with the private healthcare sector. Some back-of-the-envelope maths will tell you that's more than 90 additional surgeries a day for the next 115 days.
That's a lot of daily surgeries. How many hospitals have we got in the country? How many private? We've got 2, 3 here in Christchurch. How many surgeries can you get in a day?
Fuck it, if I know. It depends on how, I guess it would depend on each hospital and region.
That to me either is just impossible, or they have so much overkill in terms of staff in the private sector and so much underfunding in the public sector.
I mean, that could also likely be a possible factor. I wouldn't be surprised if there was a lot of things adding to that.
Something that I will bring up that I really appreciated from Gary Payenda when he was last on, I think it was last time he was on, talking about the partnership between private and public health systems. Where
I've got it queued up if you want us to play
you
it.
have?
I already thought about that when I was watching it, so I already queued it up.
If you can, if you've got it queued up, that'd be great.
Yeah. I'll just share.
He had some really good insights around the partnership between the two sectors, and I thought it was good to have that because quite often we like to shit on private health, but he did make some really good points.
Yeah.
Look at you. Look at you go.
Simeon's mind or Mr. Luxon's mind. These people are about money and power. If you affect their ability to make money or their ability to own power, then you will see change. I had a friend who voted for National this last time around. He's not super stoked about it. He's an emergency doctor as well, and he's got some issues now. But he, in total seriousness, proposed that politicians not be allowed to take private health insurance, that they have to go to the same public hospital that our patients have to go to. Yep. And I mean, I laughed. I thought he was joking at first, but he raises what I think now, thinking about it more, is actually a good point. As long as these people can live in fancy neighborhoods and have private health insurance and have private schools and never have to feel what, let's say, Northland patients or New Zealand patients have to feel. Christopher Luxon, Shane Reti will never in their lives have to wait 7 hours in a waiting room full of coughing and sick and moaning and suffering people. He will never have to do that. And I think the only thing that will affect politicians is when they have to live like regular people. And until you affect their ability to get money, so, I mean, Imagine how much money ACT or National or Labor, whomever, will get if they make laws that help the real estate industry, the private hospital industry.
Yeah, imagine how much money they would make. That would be a lot of money, guys, wouldn't it?
The clip that I was thinking of, although that's fantastic, also answers the conversation. Thank you. I can't find it. But he was talking about the relationship between the two, private and I totally agree.
Oh yeah. Oh, and
should
you're
go to
talking
public
about the
hospitals,
one
man.
where it's basically the fact that you lose a lot of there's a lot of money that gets eaten up by the administrative.
No, it was
Oh.
more explaining how the two actually are quite important to run side by side, because a lot of specialists will go into the private system because they're talking about like really high skilled, very niche things and surgeries and stuff like that surgeons have to do. So they tend to go for the private sector, and the public sector that allows them to work on people that perhaps can't afford private health insurance, and emergencies, essentially. So if you've got a bunch of people there who are doing elective surgeries, then those doctors in public won't be able to help those who have acute health or emergency health issues that arise. So it frees up, if we can, it frees up those doctors for those emergency cases, if we can use the private system. However, it has to be a correct balance between the two. Oh wait, did you guys say you can't see them?
Nah, yeah, that's all right. I've already gotten the message. It's only my one though, so it might just be when we use it on a certain one. So
okay, interesting.
I don't know why that's doing that, but that's all right. They heard it.
The same surgeons in public and private does not free up any doctors. Look, the way that he, I don't know the exact nuance, but the way that he was saying it is that the two work in tandem quite well, but we shouldn't, just because the private sector exists, doesn't mean that we shouldn't fund the public sector. And then while we may be, putting these all onto the private sector to help us out with the waiting lists, we should be funding the health system in order to make and investing in it in order to make it ready so that it doesn't happen again. We should be employing more doctors. We should be putting more money in. We should get the infrastructure that we need in order to successfully continue to keep those wait lists down and give effective healthcare to everyone. And then if you really want to, you can pay into your private insurance and you can get great food and some of the best nurses, and maybe some of that money that you're paying in health insurance will be paid back to the health system thanks to corporate taxes. And then everyone else can have just really good public healthcare instead of
that's woke.
dying because we can't get our fucking surgeries. Anyways, any thoughts?
I mean, I think the doctor sums it up. I mean, I'm just frustrated and sick of seeing them wasting time and money at this point. It's all just been to go Labour bad. And at this point, like, even the Labour bad doesn't really feel funny anymore. Like, it's losing its funny because this is all just becoming like, oh, cool. How long are we going to have to take to keep fixing all of these new things that they keep breaking?
Yeah. Keep defunding it. Breaks. See, we told you so. The thing that I don't want to see happen is the American model, in that we basically will have to start paying. I mean, by all means, paying more taxes. But as long as you pay more taxes and like actually build the shit that I need for my public healthcare, go for it. But I do not want this private health insurance system that they currently have in the States, because that is fucked.
You might not, but this government does. So screw you and screw everybody else until we can get them out.